My name is Cynthia Jones, and I am a master's candidate at the University of Texas in Arlington in nursing administration. The following presentation is in partial fulfillment of Nursing 5309, Teaching and Learning Strategies. I selected the strategy of debate to present. Debate has been defined as an educational strategy that fosters clinical reasoning and critical thinking. It allows for propositions to be examined, exposing the truths and falsehoods about a subject. Additionally, it heightens the awareness of individuals' beliefs, values, and attitudes. This process utilizes inductive and deductive reasoning as a skill to examine and identify relationships. Debate follows a format where a topic is introduced and more than one party present different views for discussion. Today, we have two staff members here, Kim McWhorter and Sonia Sweeney, who have been given the topic of 8-hour versus 12-hour work schedules. Kim has researched some information regarding 12 hours, and Sonia has done so regarding 8 hours, and they would like to share their views on the situation.
Well, one of the things that I'm in favor of for the 12-hour shifts after the research that I've done is that you get more consecutive days off and you get more time to take care of appointments that you wouldn't normally get to take care of in an 8-hour shift. A lot of doctors' offices are closed for the lunch hour and they close at 5 o'clock. And if you work the normal 8 to 5, 8-hour shift, then you end up having to take time off to go to a doctor's appointment. Whereas when you work the 12-hour shifts, you get your work done in your 12-hour shifts, and then you have more consecutive days off and more time to go on 3 or 4 day trips if you like to travel. So it gives you longer, more consecutive times of period to spend with your family or taking care of appointments that you couldn't do with an 8-hour shift.
Well, I feel like that with the 8-hour shifts, you have more time in the evening with your family, doing what you need to do.
So that's more time in the evening. Versus more time consecutively. Okay. Okay.
And I do feel like with the 12-hour shifts, you have more fatigue.
So maybe that's another issue.
And the argument to that has been that it doesn't really matter if you work an 8-hour shift or a 12-hour shift, because there are people that do work 8-hour shifts and then have insomnia and can't go to sleep, and then they don't go to sleep until 2 a.m. and then they have to get up and go to work again. So the fatigue issue is kind of an individualized number for each person, because the sleep is individual for the sleep patterns are individualized, not so much so on the shift that they work, but the time that they each individual sleeps.
So maybe you feel like fatigue could be affected by other factors, opposed to just strictly an 8 or 12-hour shift.
Right.
Okay. And you feel that 8 hours is going to improve the risk of fatigue?
Yes. Because they also show that research and studies have shown that there's more patient error with the 12-hour shifts than there is the 8-hour shifts. And I think that's maybe due to fatigue.
Okay, so patient errors.
And in response to that, I would just again say that you could have errors no matter if you're working 8-shift or 12-hour shifts, because you could have a baby up crying all night and it affected your number of hours that you got to sleep. So I don't think the number of hours that you get to sleep affects patient errors. The shift differences.
Okay. So you're saying that
we can all make errors, no
So,
matter.
yeah, we're all at risk for errors and once again, other factors are.
But I feel like the 12-hour shifts increases your risk for errors.
Due to fatigue.
Mhm.
So you think it's a high risk?
Well,
And
no.
you think it's affected by other factors? Okay.
And one more thing I would like to say about 12-hour shifts is that you have less staffing to worry about. As opposed to 3 different shifts of working, you're only working with the 2 12-hour
Okay, so.
shifts, so
But
it's
I
So
think-
staffing issues.
But I think it's harder to get someone that's not scheduled to come in and work a 12-hour shift. It would be easier to cover an 8-hour shift than a 12-hour shift.
Okay. So easier to cover. Okay, and your concern was, as far as 12 hours,
it's just that most people that work 12-hour shifts go in and work, they want to get those days done, and unless they get sick, of course, but they want to get their days done so that they have the more consecutive days off. So it seems to be less call-in rate when you have the 12-hour shifts.
okay. So we kind of have two different, it's a less call-in rate with 12 hours, and then it's a harder to cover a 12-hour shift in the event that you have a call-in, opposed to 8 hours. Okay. We've heard some issues here and some viewpoints regarding the advantages and disadvantages of 8 hours versus 12-hour work shifts. Now, this is an example of how debate could be utilized in education to write a strategy for learning and teaching. I would like to conclude this presentation with a thank you to Kim and Sonia for participating, as well as everyone else for participating in viewing this presentation. Thank you.